Hello, and welcome to Chapter 1 of Medical Terminology. Today we're going to look at the anatomy of medical terms. What the anatomy of medical terms means is we're going to learn how they break down words so we can understand when words get put back together, what these words specifically mean. So you'll be able to understand roots, combining vowels, and combining forms of different medical terms, suffixes, prefixes, how to build medical terms, and how to break down medical terms, how to use plurals correctly, how to articulate the pronunciation of these words, and the precision and accuracy of documentation. So, Lesson 1, Chapter 1. So, all medical terms have one or more roots. A root is a constant foundation and core of a medical term. A root can appear anywhere in this term. More than one root can have the same meaning, such as this example here. For pneumonia, pneumo, the P is silent, means lung or air. Roots are often joined to other elements of a medical term. And how we do this by placing a combining vowel on the end of that root. The combining vowel is added to more easily combine the root with other word parts. A root plus that combining vowel creates this combining form. The letter O, it's the most common combining vowel. Combining forms can be attached to another word or combining word. Like Nemo is our root, or Noom, and then we add that O as that combining vowel for pneumo. Heme plus O, hemo. We can also add a suffix like pneumothorax. So we take this pneumo and add thorax to it, or that hemothorax. Can also follow a prefix. So in this textbook specifically, they use a slash to separate out this root and the combining vowel. So this dash is used to separate word elements. We will separate prefixes, roots, and combining form and suffixes with this slash. So respirate, this is the combining form because we have this root word here, and then we have our combining vowel to make it that combining form. So here's some different examples here. So in the word pneumothorax, pneum is my root, O is that combining vowel. So pneumo is my combining form. Pneumo means lung or air. If we add, or for thorax, is a root meaning chest. So pneumothorax means air in the chest. We look at pulmonology. Palm, pulmon, there we go, is root. O is my combining vowel. So pulmono is my combining form. Ology is a suffix meaning study of. So pulmonology, this whole word means study of the lung. So different roots can have the same meaning. So more than one root can mean the same thing for one because roots are going to either have Greek or Latin origins. So pulmon and pneumomon means lung. A suffix. A suffix is found at the end of a medical term. It can be attached to a root word or a combining form. So we have some different rules for using suffixes and a combining vowel. So if a suffix starts with a consonant, it must follow a combining vowel. So an example, dermatologist. We look at dermat, my combining vowel is that O, dermatologist is my suffix. And then my vowel. To make the word complete, a combining vowel of O is needed between the root and the suffix, which begins with a consonant. If the suffix begins with a vowel, then no combining vowel is needed. So if I have the word dermatitis, that suffix itis does not need a combining vowel because it starts with that vowel. There we go. Itis means inflammation. Dermat means skin, inflammation of the skin. When we get to the integumentary system, which means studying that your skin, we'll look into this some more, but that's just kind of what it means. So let's look at some other examples here. A suffix is found at the end of that term, again, and it can be attached to a root word or a combining form. Here's our suffix. If a suffix starts with the vowel, airy, then no combining vowel is found. Like pulmonary, that airy, that suffix starts with an A. We do not need that combining vowel. If the suffix starts with a consonant, like our second example here, we start with L. L is a consonant. So we need a combining vowel in our word to make a word. So pulmonology, we have the root plus that combining vowel and plus that suffix. So pulmonary means it's pertaining to the lung, while pulmonology specifically is that study of the lung. So a suffix that starts with a vowel, such as this IA, this means a condition of. So pneumonia is a condition or infection of the lung. In the word respiration, our suffix here, ation, is a process. So respiration is a process of breathing. My word or my suffix starts with a vowel, so we do not need any combining vowel. A prefix, the other side. A prefix is found at the beginning of a root or combining form. It gives new meaning to the following root. Prefixes never requires the use of a combining vowel. So we do not need a combining vowel for a prefix. So as an example, pericardium and epigastric. Both are prefixes. Peri is a prefix and epi is a prefix. So it does not need a combining vowel. You do sometimes come across terms that may have two prefixes. You may come across words that have no prefix because not every word or term contains prefixes. So pre is my prefix in premature. Premature means before the normal pregnancy. Post-mature. Post is my prefix. So post-mature is after the normal pregnancy. Again, that prefix is found at the beginning of the term, and we do not need a combining vowel. Uni is a prefix in unilateral, pertaining to only one side of the body. Bi is also a prefix in bilateral, meaning two or both sides of the body. Again, that prefix is found at the beginning of the word. We do not need a combining vowel. And in this case, this prefix is giving a number to these terms. Lateral is that root word for both of these. So uni gives us 1, bi gives us 2. So we're using these prefixes to add a number. Here's some other prefixes. Peri, as in perinatal, is around the time of birth. That prefix can describe a situation. It can describe a location, like epi. Epigastric, epi means above. So we're above, gastric means stomach. Hypo is also that location because it's below. Hypogastric, below the stomach. So it's describing a situation, a location. These prefixes can help us figure out where something is. Prefixes can tell us a size. Micro, like microcyte, is small. Cyte is cell, but in here we're talking about red blood cells. Macro, in macrocyte, macro means large, so we're describing a size. So if we look at the word perinatal, we have our prefix, peri. Our prefixes do not need any kind of combining vowel. And peri is going to mean around. Nat is my root. Nat means birth. And then we have a suffix, all. Our suffix starts with an A, which means it does not need that combining vowel either. So all means pertaining to. So pertaining to around birth, perinatal. So if we break up words, we're able to figure out what they mean. So let's look at the next one. We have hypogastric. Hypo is my prefix. So that is telling me below. Gastra means stomach. That is my root word. Ick is my suffix. Ick. That suffix starts with an I. It's a vowel, so we don't need that combining vowel. And this means pertaining to. So hypogastric means pertaining to below the stomach. Now let's deconstruct some words, plurals, pronunciations, and precisions. So when you see an unfamiliar medical term, the first thing we should do is identify the suffix. So in the word cardiologist, our suffix is logist, or one who studies, somebody who specializes in. Cardi is my root word. We've got a combining vowel here because my suffix starts with an L, which is a consonant. So we need that combining vowel. Cardia means heart. So a cardiologist is someone who studies or specializes in the heart. Another way we can deconstruct the word, let's look at, again, that suffix, all, which means pertaining to. My is my root word. O is my combining vowel. Combining form, myo, means muscle. And cardi means heart. I said that wrong. Myo is my combining form. We have two root words in here actually. My, O, muscle, cardi, heart. Myocardial, pertaining to heart muscle. Let's look at cardiomyopathy. So we start with the suffix, pathy. Pathy means disease. There are two combining forms here. cardio, which means heart, and myo, which means muscle. So, cardiomyopathy is a disease of heart muscle. Plurals. Plural endings are frequently not based on English language. Plural forms of medical terms are based on Latin and Greek languages. So adding an S to any medical term does not make them plural. The fun part is we're going to have to memorize the plurals of medical terms. So these plural endings must be memorized. There's no secret way around it, unfortunately. So let's look at some examples. So if we have just an at the end, like axilla, that means just one. That's your armpit. A, like axillae, is a plural, meaning both armpits, two armpits. Is, diagnosis, means there's just one. Ease, diagnoses, means we have more than one. We're going to have to memorize these different plural endings because they're different from the English language. They're not based off of just adding an S, like axilla, axillas. That's not correct. It's just axillae to mean more than one. Now comes the fun pronunciation. So an error or in pronunciation or spelling of a medical term can dramatically change its meaning. So for quality patient care and safety, you need to be able to not only correctly spell, but also correctly pronounce medical terms. As an anatomy and physiology teacher as well, I also come across students all the time that pronounce words however they spell it to try to remember how to spell words. But then they're messing up their pronunciation. So when they go to pronounce these words to patients, they don't know how to pronounce them correctly. So it's something that takes practice. Saying words out loud can help you learn how to pronounce these words correctly. If you're going to be working with other medical health professionals, which if you're taking this class, you most likely will, they're going to give you funny looks if you're pronouncing words wrong. So it's very important. And it also helps to provide high quality patient care by knowing how to pronounce these words correctly. So this textbook, our textbook here, will help you in the correct pronunciation by spelling the words out phonetically. So every time we come across a new word, it will be phonetically spelled out, and it'll also allow you to hear the correct pronunciations. There's also an audio glossary with this textbook, this audio glossary is very helpful with learning how to pronounce these words correctly. So let's look at some of these. Two words can be pronounced the same but spelled differently and have different meanings. This is where medical terminology gets very confusing at times. Ilium and ilium. These are pronounced the same. Ilium. Ilium is a bone in the pelvis. What ileum, Ileum, is part of that small intestine. So knowing the different spellings, even though they're pronounced the same, can save you. Because if you're pronouncing ilium, but you spell it like the ilium, meaning the bone in the pelvis, but you spell it as ileum of the small intestine, you're going to confuse people. They're not going to understand what you're trying, what you mean, and vice versa. So knowing how to spell these words correctly is going to come in very handy. So an error in pronunciation or spelling of a medical term can change its meaning. So again, for that quality, patient care, and safety, you have to be sure you correctly spell and pronounce these medical terms. Putting emphasis on the correct part of the word can give the precise meaning more clarity. Prostate. So prostate here. This is a gland at the base of the male bladder. Prostate, if we pronounce it prostrate, prostrate, physically weak or exhausted or to lie flat on the ground. So putting that emphasis in the wrong area, also adding it an R, prostrate, instead of prostate, changes its meaning completely. So altering the pronunciation or spelling of a word can change its meaning dramatically. Many medical terms can sound similar. Therefore, precise spelling and pronunciation must be clearly differentiated. A misspelling or mispronunciation can alter the treatment and medication prescribed to a patient. This could result in injury or death of this patient. So it is very important to know spelling and pronunciation of these words to make sure that your patients are getting proper care. So here is another one. Hypotension. Hypo means low. Tension is blood pressure. So hypotension, that low blood pressure. Hyper means high. Tension, again, is blood pressure. So if somebody confuses hypotension with hypertension, this can cause a medical error. And again, it could cause death to a patient. Giving somebody who has hypotension Medication for high blood pressure, because you mixed up the terms, could kill them. Any patient that gets high blood pressure medicine, their blood pressure has to be checked before you give that medication, because if their blood pressure is too high, if their blood pressure is too low and you give them that high blood pressure medicine, you're going to kill them. So there's always safety checks, which are nice to kind of help with this, but at the same time, making sure you keep your words correct is going to be very helpful. So practice your pronunciation along with the system of phonetic spelling that's found in the textbook with hearing the words. Again, there's that audio glossary that'll give you the pronunciations of all of these words. And it's essential to prevent errors in that patient care. So as a health professional, precision in spelling and pronunciation are vital in your roles of direct and indirect patient care. It requires that utmost attention to detail and precision because a patient's life can be in your hands. One mistake can be the difference between life and death, unfortunately. Also, incorrect spelling, it doesn't just reflect badly on you, but it can reflect badly on the entire team that is working with that specific patient. Incorrect pronunciation and spelling can reflect badly on you. This is part of that importance of knowing how to spell and pronounce these words. It's helping you to look as professional as possible. So, roots provide that core meaning of these medical terms. Roots are often joined with other elements in these medical terms by combining vowels at the end. Adding a suffix or a prefix can build new words with different meanings. So precision and communication is extremely important. Thank you very much for listening. This was chapter 1. Have a wonderful rest of your day.